What's up, guys? Medic Prepper 611 back here with another video for you. And today's video we're going to talk about first aid kit mentality. And when I refer to mentality, I mean how you put your kit together and what's put in it based on what you perceive the injuries are that you're going to have to treat. One of the big mistakes I see in a lot of videos on YouTube is people try to cram everything that they can possibly find inside a kit. Because inside their head they're thinking of all these possible injuries that they may come across and that at one time have to treat. But when you're putting together a portable kit, whether it be for a vehicle, a bug out bag, an EDC, or anything along those lines where you're required to lug it around or move it from time to time, it's just not realistic to put 4 different kinds of hemostats and carry 15 different types of medications with enough doses to last for 7 days. You need to be very focused and very diligent with what you put inside this kit so that it will, you'll have it with you when you need it. And, I mean, that's the point of putting this stuff together, guys, is to have it with you when you need it. And if it's so big and heavy that you can't take it with you, you're going to leave it behind. So be very focused, very diligent with what you put in your kit, and it won't be a pain in the butt to keep in your car because it won't be too big to have in there. Or it won't be too big to put in your EDC bag because it's so heavy that you don't want to add the extra weight and lug it around all the time, so you pull it out every chance you get. My main focus when I put kits together is on bleeding control. It's one of the ways that somebody even with no medical training can have a very positive impact on the outcome of an injury that they come across just based on the ability to stop bleeding. Even when I run on the squad at work, we come across somebody with a serious injury who's bleeding, our first main priority is to stop that bleeding and limit the amount of blood loss that patient has. And then once you get past that point, it's to do it in a way that's clean enough that we're going to try to prevent infection in that patient. Because once you stop the bleeding, the next highest risk for that patient is an infection. If the bleeding doesn't get them, the infection will. So you need to be very diligent with what you put together in these kits and how you put them together so that you have, when the time arises, the proper things you need to stop the bleeding inside these patients and properly dress wounds to prevent infection. Even with very little training, you could have a very positive impact on your own outcome if it's an injury you're treating for yourself or a family member. Just by some simple knowledge and having a properly stocked first aid kit, it can make a world of difference. So this is going to be part 1 of the video, basically an intro to it. Part 2, we'll go ahead and break into this kit right here. I'll show you guys what I have in it, how I keep it stocked, and all that type of good stuff. So stay tuned for part 2.